September, as you both probably know, is Ovarian Cancer Awareness Month, and nearly 85% of women with advanced ovarian cancer will face a recurrence of this deadly disease. The threat of recurrence often causes additional worry and anxiety in an already burdensome situation. However, recent advances in treatment of ovarian cancer may add another tool in the arsenal to battle this disease, which affects so many of our loved ones in addition. Also, recently, options were limited for women with certain genetic biomarkers. Joining us today to explain more about the latest in ovarian cancer research and treatment is Dr. Robert Holloway and Ann, who will share her personal experience with ovarian cancer. Dr. Holloway, what can you tell us about the latest in ovarian cancer diagnosis and treatment?
Dr. Goodwin, thank you very much for having us during Ovarian Cancer Awareness Month. The good news is that there are more women alive in the United States today than ever before who've had the diagnosis of ovarian cancer. There's about 225,000 women who've had a diagnosis of ovarian cancer. But unfortunately, as you stated, about 85% of patients with advanced stage disease, that's stage 3, stage 4, will have a recurrence of their disease following their initial treatment, which is usually a combination of surgery and chemotherapy. Once patients have recurred, they go back onto chemotherapy. And in times past, we had little to offer these patients other than encouragement and a watch and wait, and if the disease came back, we treat it again. Now we have new FDA-approved treatments called maintenance therapies to try to maintain that remission, and that's the word that we want to get out during Ovarian Cancer Awareness Month.
Okay. And in terms, can we sort of separate the diagnosis, the advances in diagnosis and advances in treatment?
I wish I had more good news for you in the advances in diagnosis. We really don't have screening tests for ovarian cancer, as you're aware. There's no pap smear, no mammogram. I think the advance in the past decade has been the recognition that ovarian cancer is a genetically related or inherited disease for about 15% of patients. And so that families that have members with early onset breast cancer, ovarian cancer, now can be diagnosed with a gene mutation that can be checked in other family members. That may lead to screening and perhaps risk reduction surgery that can lower the incidence of ovarian cancer, and that is happening today. But for the vast majority of women with ovarian cancer, this is not genetic, it's a spontaneous event. So we're still searching through research to find that screening tool, and that's where we're at on the diagnosis side.
And on the treatment side, is there something relatively recent that you would want to bring to our attention?
Absolutely, and that's the concept of maintenance therapy. So again, for patients who've had a treatment of their recurrent disease, rather than just watching and waiting for the next recurrence, we have an oral, FDA-approved, once-a-day drug called Zejula, which can be offered to patients to help maintain that remission.
How are you spelling that?
That's Z-E-J-U-L-A. Patients can actually read about maintenance therapy and Zejula in particular, along with the potential side effects, the risks, and the benefits at a website. It's zejula.com.
So let's slow down and be sure people get that information. It's zejula.com.
Yes, ma'am.
And that's for the website to get additional information.
Yes, you're correct.
Okay. And Ann, tell us about your journey after your diagnosis and treatment.
Thank you, Doctor. Well, first of all, this is my own experience, and others may have had different experiences. What happened with me was that I was experiencing some symptoms, bloating, distended abdomen, feeling full after a few bites, and just generally not feeling quite well. I went in, had an experience with excruciating lower back pain that I'd never had before. I thought I pulled a muscle or something, but went to the emergency room, and after having a CT scan, it was determined that my abdomen was flooded with cancer, which was, of course, devastating news. That led to emergency surgery, and after that surgery, we found out that I had stage 3C ovarian cancer because the disease, the cancer had spread beyond the ovaries. As Dr. Holloway had mentioned, I was one of those 85% of women who had a recurrence, and at that point I was told that I'd be on infusion chemotherapy for the remainder of my life. Because we know this is a terminal disease, I was willing to do whatever it took to try to extend my life. Fortunately for me, after I finished that chemo, the FDA had just fast-tracked the drug made by Tesaro, and so today we're partnered with Tesaro to talk to you about these options that are available to women so that we've got choices in our treatment.
Okay. And the drug that you're on now, is that a chemotherapy medication?
I'm actually on Zejula. I started Zejula last April, or excuse me, I finished chemo in April. I started Zejula in May. And fortunately for me, I've gone now almost 15 months without a recurrence. The original recurrence happened within 6 months of completing chemo.
I see. Okay. Dr. Holloway, how typical is Ann's story?
Ann's story is very typical about her presentation and about her treatment. What's not typical historically is the fact that she's not in a watch and wait time waiting for her disease to come back. She's on a oral maintenance therapy, once a day treatment called Zejula, which for some patients can significantly prolong that remission time, and that's what's really not typical. But that's the good news that we're trying to get out today.
I see. Okay, that's important. And what would you tell other women to do or to expect who might have a similar experience?
Thanks. That's a great question. I think the most important thing is that we need to listen to our bodies. We need to trust our instincts. And if you go to the doctor with a recurring symptom and they tell you that they can't find anything and kind of imply that it's just in your head, don't buy that. Go and do some follow-up, ask lots of questions, get another doctor if you have to, but pay attention to yourselves.
Okay, that's good advice, I'm sure, for women who have possible ovarian cancer. And Dr. Holloway, what other advice, if any, would you want to give to women and their loved ones who experience ovarian cancer?
The therapy for ovarian cancer has been evolving rapidly over the past decade. As Ann mentioned, Zejula was just FDA approved within the past 2 years, and there are advancements happening every 6 months. So I would encourage patients with ovarian cancer to seek a professional who treats ovarian cancer every day and stay abreast of the current research and the treatment options.
All right. Well, let me thank both of you for sharing this information with my Health Power audience. I'm sure it's going to be of interest to them. And have a good day, both of you.
Thank you so much for spreading the word during Ovarian Cancer Awareness Month.
Very grateful to you. Thank you.